Good morning, 5:44 right now. Living with diabetes can often mean coping with painful complications.
Now doctors may have figured out how to treat one of the most dangerous conditions without surgery. CBS 2's Dr. Max Gomez is here to explain all of this for us.
Good morning, Mary. Good morning, Maurice. You ever play with those little magnets when you were a kid?
Mm-hmm.
Well, you know, it turns out that doctors have long known that those magnetic fields can affect everything from pain to bone healing and even depression. And now magnets may also work to treat a painful nerve problem that diabetics suffer called neuropathy, and they may even help grow and regenerate nerves.
These days, Joan de Blasi gets around pretty well, but that wasn't the case just a few short months ago.
I was walking with a cane with difficulty and still couldn't tap my feet or feel significant sensation in my feet.
The problem is that Joan is a diabetic, and her high blood sugar had damaged the nerve fibers in her feet, which caused both numbness and pain.
My original pain was a pain in my left thigh, and then it spread to my feet, and it became very difficult for me to walk on this left leg.
But then de Blasi saw Dr. Michael Weintraub, who was experimenting with this device. Its spinning magnets produce a pulsed electromagnetic field that stimulated her feet. The results were just published in a study of diabetics who suffered from painful neuropathy. Some patients reported that their pain got better, although overall it wasn't quite statistically significant.
They had reduced pain in those groups. We also found that we selectively influenced burning and itching pain as opposed to routine pain.
But perhaps even more important is that biopsies of the skin of the feet show that the group treated with magnetism actually regrew some of the nerve fibers they had lost due to neuropathy.
So it opens up a whole new idea that we might be able to help regeneration of damaged nerves in the spinal cord. And there's a lot of possibilities here, Max.
De Blasi was in the magnet group, and she's convinced it helped her.
Now I can walk without a cane, and I can tap my feet, both of them.
Now, the present study only used the magnet device for 2 hours a day for 3 months, and the trend was better the longer it was used. So the hope is that continued use will help more diabetics with their pain, and of course, there's really no downside to the magnets, no real side effects or any problems with
and
it.
How
so
positive for her that she's now able to walk without that cane.
Big deal.
Now tell us more about these nerve fibers regrowing, and doctors seem excited about that part of the story.
Yeah, because it's really interesting here. The group that used the magnets regrew nerve fibers, while the control group continued to lose fibers, and they were the same fibers that are involved in the kind of burning and itching pain that's common with neuropathy. Plus, there are other diseases that can lead to neuropathy, lupus, Lyme disease perhaps, so it might be useful there. And the fact that they can grow nerve fibers might be important for things like spinal cord injury or regrowing nerve fibers, for example, when you have to reattach a limb or finger or something that has to be surgically reattached. It's been lost in an accident or to trauma. So interesting, and again, very little downside.
Right. Why not?
Yeah.
Thank you so much, Dr. Max Gomez.
My
Good to
mom's been
see you.
using magnets for years. Yeah, she had a back thing with magnets and some foot deal she had, and she swears by them.
Yeah, a lot of golfers use them too.
Yeah,
try to eliminate pain, etc.
None of us would know that, but
No, we don't know anything about that.
Well,
We just fight through the pain. That's
To learn more about it, I guess you could go to a magnet